that's done. And now I'm going to get rid of all my champagne bubbles if possible. All the bubbles that I created. See those tiny ones like that? If you can't get rid of it, that's okay. But if you can, try to get rid of it. It won't go anywhere, so that's okay. Push it up. Bigger bubble. Look at it again. All I have is like little tiny champagne bubbles in there, so I'm okay. You don't want any air in it, but I can't get rid of it. And put your cap back on. So now I'm ready. And this, I'm gonna label it with medication name, right? Phenergan dosage, 6.25 milligram. How are you gonna get it? You push over how many minutes, right? So there's something that you need to look it up. So it's gonna be over 2 to 3 minutes, depending on which drug reference you look at. Back in the package. I'm gonna prime the saline for. This morning I got shoot at my face shield. It's like, good thing I have my face shield. One of the students was trying to like prime the saline, and instead of like push it into the trash can or something, she just go and it shoot to the saline and drop. It got really long. So you can push some. It's gonna be like that. It's a little harder to break that seal, so just make sure you push some of it out. Put this on. This is gonna be before medication, and I need one for after, right? Ready? And then this is already done. I already scanned everything, so this can go in the shelves. Okay. And again, yeah. So this is my push part, and my patient is getting supposedly IV fluid infusion, right, at 50 mils per hour. Oh, I think I have it caught. It's supposed to be like slow infusion like that. When you're doing an IV push, you want to give it to the one that's closest to the IV side, because you want the push rate to be correct. You want the patient to get the medication as fast as possible. But when you're doing your piggyback, if you attach it here, it won't be long enough for you to hang it up there. So that's why you have this upper port where you can put it for the piggyback. Okay? We're gonna do the push first. So this time I'm gonna go ahead and put on my gloves. So far so good, you guys? All right, good. So I'm gonna clean it here, and then sometimes I see some people would clean like this. You don't want to just clean the tip, right? You want to, because then this part is not clean. So I hover over it, the whole thing goes on there, and I call it, give your, your hub a good sponge bath. That's what I call it. I like to create nicknames like that to make it more fun. Otherwise your day is so long. Okay, now I'm gonna say 15 seconds. We're stimulated 15 seconds, wait for it to dry, and then look, it's dry. You're gonna take your cap off, and then you're gonna connect it. You can use your two-hand technique, so that way you don't miss it and slip, and whoop, now you have to get another one. Good thing I have extras. Now you're gonna kink it here, right here, so that way medication doesn't go the other way. Okay, so you see this little kind of looks like a Y. Okay, so you want to kink it, so medication goes that direction, or flush goes that direction. Can you see, Megan? So you kink it here, and then you push it in that way. Okay, and you push like 3 to 5 cc. You can push a little bit in, and then pull back. Make sure that this is open, so you can kind of see. Yeah, you can pull back. You see, for return, you can see it right here, and you're good. Okay, close this. Okay, 3 to 5 cc. I don't see any infiltration. Patient is not screaming at me and saying, "Ow, that hurts." So Mr. Dale is doing good. So I'm moving my face shield. Hold on. All right, 3 to 5 cc. So you're good there. Next, I'm going to do my medication and look at the label. And again, 6.25 IV push over 2 to 3 minutes. Okay, take my cap off. And you see I'm kinking this the whole time, so nothing is flowing back the other way. It goes to the patient. connect it, and then we're just gonna do a simulated 3 minutes. Otherwise, we stare at each other for 3 minutes.
Did you
So-
say if this is our checkup, do we have to wait the 3 minutes, or can we simulate and tell you I push this over 3 minutes?
We can simulate it, yeah. But at least, push it over a little longer than 10 seconds. And you can talk to your patient, educate them about the medication, what they need to do, what is the antibiotic. I see on your chart that can you tell me your history? They'll tell you like, oh, I have history of CHF or heart failure. Do you weigh yourself every day? Do you weigh it yourself at the same time? Kind of talk to them about how much they know about their disease and how they manage it at home. It's a perfect opportunity for you to do teaching, yeah. Because you can't go anywhere and the patient is stuck with you, so use that opportunity. Okay, so now that's in, and then this is all still medication, so when you're washing it initially, you want to make sure that you go kind of slow.
Dr. Lynn?
Yes.
If we get the IV piggyback for the tip-off, do we have to do an IV push as well with it?
No.
No? Okay.
Yeah, so it's either or. This is just that you can practice everything on once, but now if you get the IV push, you get the IV push. If you get IV piggyback, you get the IV piggyback. Yeah, not both of them, yeah. Okay, so I flushed it and everything is flushed fine. Patient didn't complain of any discomfort. It's just like, yeah, I feel a little sleepy. That's probably to be expected because Flanagan has that side effect. And then you're good there. Any questions? No questions? Good. Okay, good. Now I get to the fun part. Okay, next, coming back to the checklist, I am going to back to back. So I'm going to check it again, explain to the patient. It's going to be the first time the patient receives this antibiotic. As the nurse or the student nurse, what would be the most important thing for you to do as far as patient safety goes?
Allergies.
Yes. So as a nurse, you want to stay with the patient and just say, this is the first time that you're receiving this medication. I want to make sure you tolerate it really well with this medication. So I'm just going to stay here for about 5 minutes, make sure you're okay. If you feel anything different, tell me. You don't want to scare them with Steven Johnson or with things like that. It's like, can I not take that? I mean, yeah, those could happen. That's why we have a code blue button at the head of the bed. But if you tell them anything about the severe kinds of, reaction that could happen, it doesn't happen to a lot of people. It's very, very rare. And I don't take the medication, they'll be scared to death, right? Yeah, but it could happen. So, all right, so I have medications here. Patient agreed to it. We'll check it again with the MAR. Everything's scanning okay. Not expired. Everything looks good. So I'm gonna get my tubing. This open. And then you have this for, you could lower the primary when you're ready to do that. And then, anytime you get the tubing out of your bag, you want to close the roll clamp. You can see, okay? Oh, Megan is falling asleep. No. So make sure you close the roll clamp. That means it's closed because it's tight. It doesn't go anywhere, right? And then if you open it, then now you can actually move this a little bit, right? Now it's open. This is open. And then you're going to close it, okay? Now, I'm going to spike the bag. Take this off. And this is all sterile, so you don't need to wipe anything. And now you're gonna, on the checklist, it should say to take this off. I'm trying to do this and show it at the same time. Okay, once you take this cap off, this spike is sterile, so make sure you don't touch anything. If you touch something, don't wipe it with alcohol. Get a new tube. Because it doesn't work that way. Because once you wipe it, there'll be some alcohol residual in the spike. It's not, you don't want to give patient IV alcohol, right? So just get a new tubing. Yeah. And now you're gonna spike it right here, okay? And just put it in, and then just basically squeeze it in there. There's not really a spiking motion. So you just basically keep squeezing it in there until you hit, there's a little line there, you'll see it when you're doing it. And now you can squeeze here or not because you are going to back prime. So I'm gonna set this down here, and now you're gonna get your alcohol pad. And then this time you're gonna scrub the hub up here on this one, okay? Because remember, this one is not long enough. If you attach it here, you're gonna hold it there for it to be infused. That's gonna be too much water, right? Yeah. So we're gonna scrub this upper port for you to connect it. So hover over it. Just gonna scrub it. Okay. And then, if you're afraid of you might have messed up something and create air bubble, there's a clamp here that you can clamp this tubing off. So it doesn't create an air bubble. And then when you run it with the pump, you can pause the pump. We'll learn it next week, okay? So now that's closed. Don't touch anything, you stay there. And then you can take the cap off. And then see this part is moving? Megan, can you see it? So this part is moving.
Send me a little to, like, towards you. How do I?
Is that good? Okay.
I just like see like where you're hanging the bag at. That's the only
Okay.
thing.
So this is the IV pole here, and this is the
Oh,
tubing. Okay. So see this part is moving. Make sure you hold it steady. Otherwise, you're gonna miss it and then contaminate it. Okay. So you're gonna hold this, and I like my two-hand technique because my hands shake sometimes. Put your two hands together, and then you can like attach it like so. And I'll do it again just so that you can see it. So now it's attached. Nothing is going anywhere. Take it off. Too tight, can't take it off. Make sure this is steady, okay? And now you're just gonna push it in carefully, lock it in place. Now it's locked in place. Now I have my secondary tubing connected to my primary tubing. This is my secondary, my primary, right? And now you have this roll clamp right here, and you can open it. And I have it sit up right like this so I can see the fluid coming in. Once you open it, you'll see this primary fluid coming down, and it's gonna push it into your secondary tubing. Maybe. What is it? Maybe I open it a little bit. You can see it going up.
Just a clamp on that green clamp.
Like, doesn't wanna go anywhere.
The green, yeah.
Yeah, it's just like, the pressure is not high enough. There we go. Get out.
Your clamp's still closed there, right?
I think it goes to here.
Yeah, it's just that pressure is not very high, but you can see it how it's going, right? You want it to be like halfway full. And now you can hang it up here. And now you're gonna lower the primary. Remember physics, fluid goes down. Water, if you let water go, it's gonna go down, right? So if you want this one to go first, you have to lower the primary for it to go. Make sense? Okay, so now you want this one to be all the way open, the secondary tubing all the way open. Now I can open this balloon, the green clamp, okay? Then you're gonna control, now it's a little too fast. I'm gonna control the flow rate from my primary roll clamp, okay? So you open the secondary all the way, control it from the primary, okay? So we say like what? 1 drop every 3 seconds. So that's about right, and then you just let it go. And then you'll just have to periodically check on the patient, make sure it's okay, you stay in there, watch the patient's doing fine, continue your teaching, continue cleaning the room, do whatever you need to do. Maybe you can use that time to finish your assessment of the skin, the pedal pulses, or whatever you didn't assess earlier. Perfect use of time, and then just keep going. The patient's doing great. So now, about an hour later, the doctors say we're gonna change antibiotic, right? And then you just go get your second antibiotic. They wanna take my gloves off, and put my new pair of gloves on. Okay. And now we're gonna switch it to,
How often is, like realistically, are we gonna have to count drops versus just using a pump, like in a clinical setting?
probably very rarely. But the good thing to learn about this is you know how fast it's supposed to be dropping. So that way when it's going like, let's say if I set it out, it's supposed to be like 1 drop per 3 seconds, and you see this, it's like, that's not right. then you can like lower down the roll clamp and get a new pump. Or it could be the tubing, because that happened to me once where it's like the pump, I switched the pump and the pump is working fine. There's no beeping, everything looks great. It was the tubing. So I changed the whole set of tubing and everything was wrong. Because it could be the tubing was not right. Yeah, so it's a great question. You probably will not gonna use this technique, but it's good to know how fast it's supposed to be like dripping. Yeah, good. All right, now we have, the doctor changed it. So we're gonna change it to this antibiotic. So this is azithromycin. Okay, and then I have my tubing here. I have my male-female cap. So it's this. Okay, so the reason we want to cap the tubing could be the doctor, do some tests and then realize that we're gonna restart this again. So if that happens, you already have a tubing. Tubing is good for 4 days, so there's no reason for us to like waste the tubing, right? If it's still good, just keep it. So to keep it sterile, you're gonna close the roll clamp. So this is all infused and everything is good. And if you are afraid to create air bubble, same thing, you can clamp it off here without messing with the roll clamp on the primary tubing, okay? And then what you're gonna do is you're gonna take it off here, and then you're gonna put the Y cap on the secondary tubing, okay? That's what we're gonna do. So you can open this up, and you're just gonna loosen the cap. Make sure you can take it apart. Let's put it back in here so I know what it is. And now you're gonna take this tubing off the primary. Okay, now I take it off. You don't have to do anything here on this hub because it's a lock system. Everything is closed off. Okay, you just let it go. And then now I can get my cap. I'll just switch hands because I'm right-handed. If I do it the other way, I'm gonna get confused. Okay, and then you want to make sure that this movable part goes all the way up to the tip so you don't touch anything by accident. Now you can use your two-hand technique. Put this up like this and lock it in place. And now the cap is on there good. If this tubing hits something, it should be still sterile. But I like to keep it up like this. So that way it doesn't hit anything that's dirty. You can just have it put like this, or you can have it like that, like up here. That way it stays up here. Yeah, you don't want it to be like angling and hit anything because it could be something dirty. Here, the patient could have a tracheostomy or the patient's coughing and sneezing and something, and then just hit their sputum. And it's still not clean at the tip, even though it's capped. If it hits something really dirty and gross, I probably would still check the tubing. So I want to keep everything clean up here. Now that's good. Now I'm gonna get my secondary tubing here. My medication here. Again, I'm gonna check, make sure nothing is flowing in here. It's not expired. And then this is intact. The color looks good. My tubing looks good. Okay. So then you can compare your medication against your MAR. Do your 3 checks, order right. The doctor ordered it, and this makes sense. The rate is correct. You check clinical farm or your drug guide. Make sure everything match, and I'm gonna compare it again. That's this one next. Back every 24 hours. So I have it good. Now I'm gonna go ahead and open my tubing. Put this over here. And then remember to close your royal clamp, okay? And now I'm gonna get this, take this off. It's your blue cap, and then you're gonna take this cap off. Make sure this tip doesn't touch anything dirty. Good? So far so good? Okay, so now you're gonna do your back prime, right? Same thing just like the other one. And I'm gonna get my alcohol pad. Okay, hang out 15 seconds. Good, hang out 15 seconds. Stay there. Carefully put this here, cap off. And then this movable part, same thing, on. then you can go ahead and open the lower clamp. Make sure it's lower than the primary.
So are we not gonna squeeze?
You don't have to squeeze because you're doing back clamp. You
Yeah.
can if you want to, but this, see how clear that is? There's no air bubble. Everything is nice and clear. If you squeeze the chamber, sometimes it creates a little extra bubble in there, so I actually like the back climbing method better. But yeah, of course you can prime the secondary tubing the manual way. But if you're doing that, you have to be very careful because if you open it too fast, you might waste some of the antibiotic, and then then you don't know is it still good to give it or should we get a new bag, depending on how much you waste. So I actually prefer it this way, so I'm not wasting any medication at all. And now I have this on there. This is wide open. I'm going to open my green clamp, and I'm gonna go ahead and control it here. And this one I'm gonna, according to the drug guide, you can go a little faster, about 1 drop per second. So open it up some more. Yep, there you go. It's a little too fast. Now you can roll it down some. Yep, that looks right. Any question? Yes.
If we're, how long should we spend in the patient's room to see if they have an allergic reaction? I think with blood it was like 15.
15, yeah. I would say medication, you can just stay like 5 minutes. Okay. Yeah, they're gonna have like a really severe reaction. It'll happen like right away.
Okay.
Yeah, just know like that happens. If you know this is the very first time you're receiving that antibiotic, stay with the patient. You don't have to scare the patient. You could be scared, but you don't want to show that because you're gonna scare the patient. Just tell the patient, I'm just gonna stay here and then finish my assessment. And if you feel anything different, if you feel itching or short of breath, those you can tell the patient because those actually are, more common than the Steven Johnson. And if they tell you something, I don't feel good, and say, okay, tell me more about why you don't feel good. At that point, you say, okay, stop freaking out, but I'm not gonna freak out. I'm gonna call my charge nurse or my instructor or somebody. I mean, I should be with you, but like, if you're the new nurse, maybe your preceptor or your charge nurse, like, I need you to be like standing by because my patient is complaining of this, and I want to make sure that the patient is not having a severe allergic reaction. Yeah, I think some patient has a reaction. I think it's normal, but anyway. Good so far? Okay. And then make sure I have everything finished. Okay. Did all that. Start priming. Okay. Yeah, and it's actually highlighted here how you do it. So if you look at it, oh, okay, this is how you're gonna calculate, and then you can come back and evaluate how the patient tolerated. And we already demonstrated on the male-female cap, and documentation is all here. So for today's documentation is, your medication that you administer, your teaching like for Phenergan, and response like does the patient feel better after Phenergan. So those are the things that you can document in your EHR. Okay? Any question? If you don't have any question, we can go on.